Greetings. My name is Kaylon. Today I'm going to be talking about a couple of different injuries and, signs, symptoms, how to treat them, what to do if you have them, different things of that nature. The first one, let's get started. One, the first injury I selected is a grade 2 concussion. And normally and only you're going to have, concussions within your head. A grade 2 concussion, yeah, it has to do with your brain hitting the side of your skull. Uh, Signs and symptoms: loss of consciousness for less than a minute, memory loss lasting from 30 minutes to 24 hours, headache, dizziness, confusion, symptoms normally lasting from 1 to 7 days. In order to treat this, you can, stop doing your activities, which you definitely need to be removed from your activities, especially contact sports and things like that. Monitor your symptoms, rest, that's very important. You know, using cognitive tests and things like that, such as, number sequences and memory things, to figure out, are your symptoms getting worse or better, and definitely go see a physician. The next injury I selected was a throat laceration. The location where your throat is going to be lacerated that I'm going to be discussing is the front of your throat, where your trachea and blood vessels are. Severe bleeding, pain, and possible difficulty breathing if the cut is deep are some of the signs. I think you'll notice them if those are the signs. In order to treat this, you should apply direct pressure to stop bleeding, to stop the bleeding in that area. Cover it with gauze. Monitor the airway, and definitely go see a physician immediately. The next injury I selected is a rib fracture. This is, on one side of the thorax, either the left or the right or the top or the bottom, just any part of your ribs, basically. There's a whole bunch of different signs and symptoms. A couple of them are sharp pain while breathing, tenderness, swellingness, pain that increases with inhalation, difficulty moving. In order to treat this, you can apply ice to reduce the swelling. You can limit your physical activity, see a physician for imaging and clearing, such as like x-rays and things like that. The next injury I chose was a hernia. They do not feel nice at all. The location is going to be the abdominal wall, where your intestines can bulge through some of your weak tissue. Some of your signs and symptoms are going to be bulging in the groin or lower abdomen area, pain, definitely pain, discomfort, possible nausea. In order to treat this, you should use supportive equipment temporarily. You should definitely rest. You're going to need rest. And, surgical repair. So talk to a physician or a doctor of some sort, because hernias do not heal on their own. 5. The next injury I chose is it's called a brachial plexus brachial plexus injury. Apologies. It's also referred to as a stinger. That's what I normally remember it as, a stinger. It's normally around the shoulder and neck area where the nerves either stretch or compress. Some signs are numbness, burning, tingling, and tingling sensations down your arms. Another one is temporary weakness, or limited range of motion is also a good one that only happens with stingers. Some treatment for this You need to rest briefly, assess your symptoms, check your strength and your range of motion, return to play only to sports and things of that nature or heavy lifting once all of the symptoms are gone. Thank you so much. I appreciate it.